also,
Oh, sorry about that.
it's okay to be in sync with your physicians, with your docs. And what do we want to do here is be able to also provide paramedics with additional scope of practice. It's a little different than if you were going through the hospital route. So how this will work is that we would send you a contract, and this would be a 1099 contract. And with this contract, you essentially would contract with us, IES. And IES, then we would act as a vendor to both the Vintage and the Woodlands. So we're looking right now actively for paramedics and paramedics who have a proven track record and would work under my license. So why? So we've got a lot on that other slide. Who am I and who is IES? Well, IES, we spanned over 2 million ED visits last year. We're a large regional company, if you will. Most of our book of business is in Texas. We staff all of the Baylor Scott and White in Dallas. We have staff a few in Central Texas, and then we also staff the CHI locations in Houston. We have no private equity, which means that you don't have to worry about outside business trying to determine how things are run. There's no private equity in our group. We are physician owned. We are physician led, and I'm one of the leaders of the company, and I work at every single facility. I work at the Vintage. I work if this opportunity works for you, I'll work alongside you. We are actually in the front lines. I live in Spring. I live 7 minutes actually from the Woodlands. We have a very active, proactive local leadership as well. And we've been in Houston since June of 19. As mentioned, we staff 16 hospitals. And right now we would be starting this. And anytime it's a startup, it's just very important that we get the right people for the program. We're all about teamwork. And I know that this program is going to be very successful. My own individual background, since I would serve essentially as that medical director for you and medical control for you, my hometown is San Antonio. I did my residency in UT Southwestern. I was chief resident there. Didn't like how we didn't have a good way to show future chief residents how to lead, so I became interested in administration then. Did a 2-year administrative fellowship in Dallas and the surrounding area. I have plenty of clinical experience. I've clinically worked at 40 different sites. These are not like I've gotten credentialed. These are actually sites that I've worked at. I've been a medical director at least 12 times, regional twice, and right now I'm currently working on my healthcare MBA. So always really working on how I could help serve my docs and our crew, our APPs, everyone that works for us. As mentioned, I'm local here. I live in Spring, 7 minutes from the Woodlands. Love to spend time with my family and really always striving to stay healthy. Love racquetball, and through my regional role, I really got into aviation. So I love that part of sometimes taking up my medical director. So you can see on the bottom pictures from Sugar Land, taking them out on a fly around the patch. My role here, as I mentioned with you, would be to work in tandem with you and make this the best program. You would not only be a pace setter in that we would look to potentially expand this program to other hospitals, but my role would be to support you, to listen to you, and continue to make changes as we need to make those changes to continue to get this program to thrive. My why as to why I do what I do, especially working with paramedics, working with my medical directors, is I just absolutely love to remove barriers. I love to create programs, create teams, and I see that as my way to contribute back, give back my impact. I can be a lot more impactful this way, removing barriers, red tape, than I could ever be at the bedside. So it's something that I truly enjoy. Going back, so that's, in a 10,000 foot view, we zoomed out. We talked about what the program sort of entails. We've talked about what company essentially you'd be working for. We talked about who would be your medical director or medical control. And then now we're going to talk about a little bit about who we're looking for. We are looking for paramedics at this time, paramedics. And in order to match our culture of IES, our vision for IES is to be the best place to give and receive care. And we value integrity, always doing the right thing when no one's watching, compassion, respect, collaboration, accountability. And we love the idea of being stable. And that stability comes through hard work, through giving 110%. And you all would also be included in this sense of community. It is really important for us, as you can see from sort of that background picture, to understand that that anyone that's interested is going to be instrumental in creating that foundation. So right now we're building the foundation of this program. And what's again unique about it is that it's not through the hospital in regard to being employed by the hospital. This is working similarly to the structure that you would see in the ambulance. What is this going to look like? I will personally interview you. We would talk about your standing within the EMS agency, and we'd get medical control approval. I've already talked to Jerry about that. IES credentials would set up the workman's compensation piece. We would do license verification, background check, UDS, and also know that the hospital will have certain competencies. You all are going to be flying high in regard to those competencies, but also know that there may be some pieces that may be a little bit new to you that will be some of that expanded scope that we'll talk about a little bit in a little bit. What is a payment going to look like? Well, you will send me essentially our practice admin. Her name is Elise. You would send her invoices, and then I'd get them approved. We'll get them to IES, and then we could either send you a physical check or a direct deposit into your account. This is completely your choice. You will be responsible for filing your own taxes. Remember, because this will be 1099. Right now, where we are starting our paramedics for this program, depending on the level of experience, anywhere from $27 to $30 an hour, depending on that level of experience that you've got. And this is a prelim of what that schedule is going to look like for both facilities. All right. So I know there's a bunch of numbers on this screen. The lowdown here is that we'll have at each facility one paramedic. There'll be 10-hour shifts, at least initially. If we need to expand or 12s work better, again, that's something that we would discuss. We also have to make sure that the hours make sense. So we would ask for some flexibility to make sure that this is something that works for you and also works for what we're trying to accomplish in regard to flow in the emergency department. And then you'll notice that Monday is double staffed. So single staff, 10-hour shifts every day of the week, except for Mondays. And why Mondays? Because medical Mondays. You all are very aware of medical Mondays. What are we going to start with? Understand that this is a foundational program. What does that mean? That first we have to get it off the ground before we can start adding different pieces. You all are very capable. You all can do significantly more than this, but we need to essentially crawl before we walk, before we run, before we fly. And it's going to take us time, but I know we can get there with talent. I know we can get there with determination and showing what you all bring to the table, right? I can tell you, which is a fact, in one of our other markets I believe it's Kentucky, they also have a paramedic program, and their paramedics right now are doing other things outside of this scope of practice to include medications, to include different other pieces that you all are very well trained to do and capable to do. But again, we've got to get the program off the ground. Right now, you're going to be instrumental in helping us with flow. And that flow, during that busy part of the day, being able to start IVs, IOs for resuscitations, I will personally train you and guide you through getting checked off to do ultrasound guided IVs. So again, that's a skill that not a lot of people have, and I think it's very necessary. Your usual drawing blood, helping us put the patients on monitors, 12 lead EKG, PPE as needed. I also would train you to help us with the wound care piece, splinting, procedure trays, chest compressions, Lucas, the usual resuscitation piece. As this program grows, again, one step at a time, we would determine in conjunction with the hospital where we can also help promote flow and help promote helping our emergency departments run. What is the attire going to look like? Scrubs. I'll get definite scrub colors, and I'll make sure that that's what the hospital is wanting to do. And the timeline, we're trying to get this off the ground ASAP. Even though if we can't staff it fully Monday, essentially 7 days a week, we probably preferentially want to staff it on the busier days at first as we get more applicants into the program. But that is a quick introduction of, we talked about who we are, we talked about what this program is intended to do, how this program is going to happen, why this program is going to happen. We talked about that scope of practice, we talked about pay, we talked about a timeline. And at this point, I just wanted to open it up for questions that you guys may have. So if you're interested, you can either talk through Jerry, or I can also put my email on the chat, and then you can directly send me an email. And what I would do is I would send you an application.
Okay, guys, I know that you're not shy. You ask me a million questions every day. So any questions you have for Dr. Rizzio or the program, or we certainly want to give you follow-up. I mean, maybe things you think about after the call, we can provide feedback on as well. So, fire away, because your questions are going to benefit others who are not able to attend today as well. So if you have any thoughts or ideas, please share them.
100%. What questions have you heard, Jerry?
Yeah, there are some questions coming in the chat.
Oh, they are? Sorry.
Yeah, let me grab, I think because some of them may be on duty. It has here, it says, will we have protocol standing for what blood work gets obtained based on complaints?
Yeah, so yeah, that's a great question. And I think those pieces we would work with our nursing colleagues to see where we can, for you to be able to have access to be able to know exactly what needs to be drawn and at what time. So the EMR that we use in the hospital is Epic, and Epic EMR would tell you exactly what medication, what has been ordered. And then through that, you would know exactly what to draw. So yes, a lot of the times this blood will be complaint specific, and even taking your question a step further. Yes, we also have delegated orders. So that are complaint driven. And typically what we do, if the doc doesn't get to the patient in about 20 minutes, we fire those delegated orders so that we can get the ball rolling. Good question.
Right. Next question is, are you able to pick up shifts at both locations, Woodlands and the Vintage?
Yeah, I would have no problem with that. It'll just afford you, you will have to be a little bit more flexible, as now you have to essentially two nursing directors as well. You've got two different facilities. The scope initially is the same at both. So you actually would, be able to do that. But if you have an interest, I mean, you saw my resume. I've worked in 40 different facilities. I love variety. That's where I thrive, in variety. And some of us are like that. So if you want that variety, you want to see different type of patient populations, you talk to me and we can see about making that happen. I personally would not have a problem with you doing that. And as a matter of fact, I think you would see very different patient populations at Vintage at the Woodlands. Woodlands has a little slightly higher acuity. I would say we admit about 30% of our patients, almost one out of every third patient gets admitted. I would say it's a little bit of an older patient population. And at Vintage, you're going to have more of that community feel emergency department. We just got stroke certified there at the Vintage. So you will also see um, a pickup of those stroke protocols. Both of the facilities have an active and ongoing STEMI program. So also that's pretty neat. And again, as this program matures, we can see about opportunities, potentially exposing you to other areas of the hospital or procedures if we're able to do that. But that's something we didn't talk about. What are the shift times again? Sure, I'll put that slide back up. So again, these shift times they're 10-hour shifts for now. Our hospital president said that if we're able to if we need more resources, that we're able to expand coverage as needed. And all of this, as I mentioned on another screen, is very important that we understand that this is all about teamwork. So we're working in tandem with nurses, our nursing colleagues, to make sure that these are the times that make sense, also based on patient arrivals.
That I did see that the Vintage team had to drop off, and I could follow up with them. I think, Dr. Rizzo, one of the things that I've had these conversations with all of the medics here that are on this call and many others who've expressed interest is this is a true partnership. You're coming into an environment, even though you're under IES, this is all about the patient and taking care of the patient, providing free and really critical care under the direction and partnership of IES and the ED staff. So we really want you to come in there with a mindset that we're partnering together for the optimal patient outcomes. Your skill sets are phenomenal. I know each of you. So I think you bring great value to the continuum of care here in the ED. And I know that Summer and Tony and Paul and him are excited about this. We have a lot of questions around it. So feel free to ask questions after this call. Don't hesitate to do that. But I want to stress how important it is. This is a teamwork. It's a partnership for our patients.
100%. I completely agree with that, Jerry. And this, again, the perfect paramedic for this program is going to be one that loves to lead, but at the same time is flexible, understands that there are going to be some up and down, and we're going to get through it together. And as you see from all that I've done, I truly do everything I can to make sure that what you're doing in the hospital makes sense for you and that you are more than happy to be there. And, again, removing some of those barriers, as you saw my wife. We had a question about the payment piece. So essentially so firstly, once we do an application interview, you get accepted into this program. Then we would send you an invoice template, which is very simple. And then you would send me that invoice template. I would approve that invoice based on the hours that you work. And then we send you a check. So that's about it. And I'll talk to our finance team to see if we can do this on a biweekly basis, see if we can make that possible. And then the other part is we are working to see if we can get this on shift admin so that you can have your shifts actually show up on your phone. So we're getting information on that.
Dr. Rizzo, there's a question from Dakota. As the schedule PRN, do we have to pick up a certain amount of hours per week? I know for them and some of their agencies, EMS agencies, they have a set number of hours. They have to meet that criteria to maintain that status. What does that look like?
Yeah, absolutely. And I think that's depending on your EMS agency where we have to afford you some of that flexibility. And we have to really start seeing who's applying, what kind of flexibility they have. From our perspective, clearly that the more consistent staff that we have, the better connection, the better teamwork will be with our nursing colleagues, with our physicians, with our our environment of care. So clearly those that have a little bit more availability would potentially be preferred than, hey, I may be able to pick up like one a month or something along those lines, and it may not be the best thing right now, because again, we need to get this off the ground. We need to start building, and that's going to require a little bit more of, maybe 1 or 2 shifts a month.
And then the next question is, how are the hours going to be scheduled?
Hours will be scheduled. So I have a administrative assistant. Her name's Elise Bennett. She will help me create that schedule. And we really try to push the schedule for the physicians and APP 3 months in advance. I know you all may not be able to have it that far in advance, but if you know what you're working and you know your sort of what you block out, then that's something that we can work with. And depending on who's going to be in part of this team, it will determine how far out we can push the schedule. But once you give us your availability, we have to play a little game of Tetris to get the schedule filled based on the availability that we're getting.
Right, and then for all of those in attendance, I don't know if you had the opportunity to meet Summer. Summer is the ED director at the Woodlands. She just given an offer, any questions you may have about the intricacies of patient flow there, she's available to reach out to. They do a great job there in the Woodlands, so don't hesitate to do that.
Summer, you want to talk, maybe introduce yourself, letting him know, we're just excited for this program and the collaboration we'll have with nurses, with docs, and get this off the ground.
Hi guys, so I'm Summer, if I have not met some of you yet. I have been here at the Woodlands since 2018. I have been a nurse almost 19 years. My background is ER and trauma ICU, but all 19 years in ER, and then because we work 2 jobs like everyone, right? We are super excited to have you guys partner with us. All the staff is excited. I think it's going to go very, very well. And as things go, the plan is to expand those scopes like Dr. Rosio talked about. We definitely have a need, and I think you guys are the perfect people that are going to fill that need in our department. And it's just that other dynamic of care. My feeling has always been, in my experience, there are ER nurses that are nasty and rude to paramedics. And I have seen it the other way as well. My opinion is nurses do a job that paramedics don't, and paramedics definitely do a job that we do not. And it definitely is mutual respect for each other's skill and what their role is. And so with that in mind, that's why I think it's going to be a great partnership between the different types of skill sets and licensing.
Summer, I couldn't have said it better. It is absolutely how do we continue to strengthen our department by forming a cohesive team. So I agree wholeheartedly. Thank you for that. Eliza asked about the platform for schedule. We're getting approval. We're working on getting approval for shift admin. I think that would be the best if we're able to get that. I think it would be the easiest. Shift admin is something that we use for physician scheduling. If we're able to do that, then that information will push straight up into your phone. So you'll tell us your availability, and you'll know what shifts you obviously, when you send your availability, we'll confirm, we'll tell you, yes, received. And then these are the shifts that we are able to plug you into. And then on top of that, then on the back end, you'll be able to subscribe to shift admin. And again, it's not a subscription that you pay for or anything. No, like what I meant by subscribe is for it to push directly into your phone, Android, iPhone, iPad, whatever, it'll do that. What is the pay and how many positions are you filling? So here's the pay. So we've talked about the pay and again, I know some of you are in and out, and I understand that. The pay is, we're starting the pay at $27 to $30 an hour, depending on that level of experience. Again, these are for this is for paramedic pay. You guys are sort of the top there. You know, depending on how much interest I get from paramedics will determine if we need to, or we have to go to either an advanced EMT or whatnot. I'm really hoping and want to work directly with paramedics. So that's where this is sort of where we're starting with paramedics. And in regard to positions, that's going to be determined by how much each paramedic has in regard to bandwidth. So, you know, if each paramedic can give, you know, 4 to 6 shifts a month, then we're talking about, you know, about 12 paramedics or so that we would be employing right now in this pilot program to be able to do this. So it will depend on how much availability, but you know, because we're trying to cover, what did we talk, Jerry? How many hours? 600 or so hours?
I thought it was over 700.
Yeah, about 700 hours.
About 720 is something what we looked at, hours, so a number of hours.
Yeah, Carla asked, is there a maximum hours you can work? So Carla, I would just say, you know, I've never been one to micromanage how much my docs or clinicians work. So, you know, you know, we want you to be rested. We want you to be on time for your shift. We want you, especially as you saw, this is a foundational program. You're setting the pace. So, you know, I don't want you to come in late or tired or you know, again, unwilling to give 110%. So you're going to be the best judge of that, of what you would think is too much. And too much for some docs are different. Like, for example, I would say 60% of my time, 70% of my time administrative. So when I start getting into 4 days, man, my other pile starts piling up. I start feeling significantly more stressed. So, you know, 3 shifts in a row for me may be too much. Some docs go, you know, we were interviewing one that wants to do 15 in a row. You know, I would never, ever consider that. So you're going to be the best judge of that, understanding what the intent is for you to give it 110%, be a great team player, feel rested, and on time for your shifts.
If From Jeff Fox, if we choose to split our time between the Vintage and the Woodlands, where our availability be used for both locations, or will there be 2 different schedules?
No, you would just let me know. It's the same scheduler. It's the same scheduler. So we're gonna have certain number of slots, and we're just gonna have to piece it together. And if you do have that cross credential, it may actually give us more wiggle room to be able to, you know, use you either at the Woodlands or at Vintage, and both locations, as you know, are not terribly far from one another. Let's see who else is on the call that I have not introduced. I'm sorry, I wasn't seeing the list. I know Joe is in and out. I don't know if Joe, I'll introduce Joe. Joe Young is our president for the market here, the CHI market. We essentially work in tandem. He does a lot more of the contracting payment piece. I do the clinical operations. Joe, do you want to say anything about the program?
I don't have anything specific. Obviously, excited to have our paramedics join us here and support you, and not just helping our EDs, you know, become more efficient, but also increase your level of education by seeing a lot of different acuity patients, you know, and just increase your scope of practice too. So happy to answer questions as mentioned earlier, and look forward to working with you all.
Thank you, Joe.
Dr. Rozelle, there is another question about the 1099. Are all the hours worked straight time pay?
Correct. For now, yes, there would just be straight pay. Good questions. Good questions.
I think it just, you know, one of the things that some of the conversations I've had sidebar with many of you is I think you have a phenomenal opportunity here to have an entry point into a continuum of care, into a healthcare environment that day in, day out, you're not typically exposed to. You come in, you bring a patient, you go to registration, go to a room and you leave. This is a huge opportunity for paramedics, particularly who are looking to further their career, their education, to understand the continuum of care better, the intricacies of healthcare. So when you come into this, there are opportunities and things that you're going to learn and see that you do not have the opportunity to see day in and day out. And so if you're interested, just be excited about that. I remember what that was like when I was off of an ambulance going into the healthcare side of the world. And I really kind of had blinders on as to what it really all meant together. So I'm excited for each of you. So look forward to that.
Yeah, and you truly, we continue to invest in what you bring to the table as well. We have a procedure course coming up October 29th and 30th. Jerry can give you the information. You know, we decided to include our paramedic colleagues in this procedure course for that reason, because we understand that, you know, that it takes time and effort to continue to build those relationships, and the patients ultimately benefit from having a strong relationship between clinicians, between nurses and EMS, and the hospital and EMS, and we value that. So you all are invited to our critical procedure course, and you will be hand in hand in tandem working with other emergency providers. In this case, there will all be physicians and APPs, and this critical procedure course is essentially a giant procedure playground. You get to do intubations from the smallest neonate head, and they're all very difficult mannequins. Now we got a preemie head. We got a 26-weeker mannequin that we just got. Tiny little thing. You can't use glide scope video. The mannequin is so tiny. So this is something that we added to the course. Scary, very low frequency, but extremely high yield. We practice on pig tracheas to do your cricothyrotomies, chest tubes. We practice a lot of those emergent procedures. So if you have an interest in coming to check us out, even talking more about the program, we have that procedure course October 29th and 30th. And again, Jerry can send you the information. One day is at McNair, the other day is at the Woodlands campus.
You know, I was just thinking, I'm going to ask an ignorant question. Is 1099 pay something that would be new for most of you? Because usually you're W-2 employees, right? So no, it's not new. Okay. Yes. No.
Probably.
Just unhook it.
Oh, yeah, we just unhooked this.
Yes,
Yeah.
stress. Yeah, so there's
That's what we
probably an
asked.
educational opportunity there for you guys that are going to be new to 1099 pay, because there are a lot of benefits that you can garner from being 1099, and maybe we will just set up even a discussion for you on how to take advantage of that, because I'm both W-2 and 1099, and there are certainly
I got scripts on it. Get back to
I'll take the book. It's not one I'm not doing. Sorry.
Guys,
There's your book in here.
meet that person.
me, I think that
Slack on the other.
I think you can do it, Jerry.
Put it on the hook.
Just hit the 3 little dots and you should be, yep.
I got you.
Yeah, sorry. There's certainly some things that we could educate you on, right? Like on how much taxes to withhold, like what are the things that you can deduct, like your gas to and from work, right? Your potential office space in your house or your apartment.
Your internet.
Yeah,
cell-
your phone. Like there's things that you can deduct from your taxes to like sort of to save you more money.
Yeah.
Piece that like there's a benefit of being 1099.
Yeah, scrubs. Yeah, any of that, you can definitely do that. Are hours flexible? Will additional shift times be added in the future as the program works? Yeah, so that's the intent, is for us to continue to grow, and not only at these 2 facilities, but perhaps in other facilities as well, to give you a different perspective. Are hours flexible? Right now, those hours are set based on patient arrivals and also in tandem with nurse staffing. So that's something that I would work very closely with Summer. And we would talk about essentially what resource we have available versus what what we need from the hospital and see if there's some flexibility in that. But the reality is, we really want to keep it to as close as these hours, because it also matches with not only patient arrivals, but also how Summer has staffed the emergency department. So there's a logic behind those hours. We've got another question. I missed it. What's the timeline start date? If you are interested, I have my email up in the chat. Please send me an email. We need to get this off the ground as soon as possible. The last pieces here would be, you'd send me an email, you're interested, send you an application. With that application, we would do a formal interview. Yeah, even if it's online. I mean, again, I live in Spring, so I could always meet you all as well. And then we would do orientation and set up an orientation and with me. And then I've got one of the nurse managers sending me a lot of the information and competencies that they currently have for a similar position, just to make sure we align with that. But to answer your question is, we want to start it as soon as possible. Feasible, probably in the next 2 weeks.
Any other questions?
Just in time for some extra money for Christmas.
Yes.
Any other questions?
I
You-
think, oh, I'm sorry, Don, go ahead.
I was gonna also put my cell phone on there for everybody. You can shoot me a text message if you want. We can schedule a call. If you've got other colleagues that work with other EMS agents, that local EMS agencies that may be interested, please pass them my cell phone number. And yeah, let's get the word out. I think that, again, that this is going to be something foundational. It's going to require some flexibility and teamwork, and I think it's going to be great. There's my cell phone. You've got my email as well. Jerry, any last words?
No, I'm just excited for the opportunity for the individuals here, and then Summer, thank you for your support, and I know you'll have a huge impact on them when they come into your setting, and the things that you're gonna offer them is great. And so that I am good, and you guys know I'm available to you 24/7. If you have any needs or questions, don't hesitate to reach out, and we'll facilitate this and get it moving. I just want to stress the timeline here is that we need to move quickly to make this happy. So don't sit on the fence too long, because we haven't officially pushed this out advertising wise. But when we do, I'm sure there'll be an influx of people interested. So please move quickly to help us and to help you.
Great. All right, my friends, I appreciate y'all being on this morning. You've got all the information you need in regard to email and cell. And look forward to working with you if this is something that you're interested in. Have a good rest of the day and a good weekend.
Thank you. Thank you, everybody.
Thanks all.